So what would MGMA like to see the federal government do for physicians and medical practices going forward?
Yeah, there's a few things, and certainly the paycheck protection is something that we would advocate for as well. There have been other programs, and so we haven't touched on it yet, but there are programs, for example, that would allow medical practices to receive an advance payment under the Medicare program. And but that is not one, it's not the same thing as PPP. In this case, it's not a loan that is going to be forgiven, but because of the cash flow issues that practices are facing, it's still important. If I can back up a little bit and talk about just really the challenge that medical practices are facing, again, we did a recent survey which showed that patient volumes are down 60% revenue on average, and it's much higher in certain specialties. 50%, as I mentioned, revenue declines for medical practices. One of the things that potentially is unique to medical practices, but there are other businesses like it, is that they don't carry reserves over year to year. So they don't carry a lot of excess cash to deal with these type of situations. And, while let's say in 2008, 2009, they were somewhat subject to the downturn in the economy, it's generally been the type of industry that hasn't had a huge negative impact in terms of when the economy slows down, because people still get sick and need care. But what we're running into now is that because cash flow has almost stopped for many practices, they don't have just the simple resources to keep their doors open, and it's largely a cash flow issue. So in terms of this prepayment program that's available, it's a way to get money in advance from the Medicare program that you will ultimately have to pay back. One of the things that we're asking for, and not just MGMA, but a large number of physician specialties and the American Medical Association, we're asking for a number of things. And one of them relates to that advance payment to deal with the cash flow. And right now, there's a recoupment mechanism that would have these monies recouped within, I believe it's about 120 days. And it would start recouping 100% of claims as they start coming in 120 days from now. We believe that would be way too abrupt to start recouping that money. And so one of the things we've asked for is to push out that date beyond the year mark, and to also do it more gradually. So for example, when the recoupment begins, you don't take 100% of every reimbursement from the Medicare program and put it toward paying back that advance payment. Instead, take, for example, 25% of each claim in the future in order to pay back that prepayment. We need to kind of, again, get through this crisis, but then not damage practices so much in the meantime, because one of my biggest fears, and one of the things that I think is going to be most challenging, and we're hearing from medical practices on a day-to-day basis, is that they're struggling, but we all know there's pent-up demand. We know that healthcare isn't being provided. We know that preventive care isn't being delivered, not because, there's not a willingness to deliver it. It's just that because of the circumstances we're in. So I see a huge pent-up demand. And if we hobble our medical practices, and even hospitals are challenged as well, that aren't a non-COVID type of care, we're not going to be able to deal with that big swell of demand of patient care that's going to be needed maybe 6 to 9 months from now.